Hey guys, so we're going into episode 11 of Anatomy Focused Laser, looking at the mouth. And in this episode, we're going to explore how do we actually apply a laser to the mouth as effectively as we can. Now, we've got two considerations here. Is the mouth open or is it closed? And depending on whether it's open or closed depends on how we are going to apply our treatment. Now, obviously, if you have just done a dental in surgery and the patient is still underneath anaesthetic, we have full access. So you're going to want to do it with the mouth open, with lifting up those lips so you can get direct contact to that gingiva. However, if our patient is conscious, we may not be going poking and prodding in here, and it can be a little bit more tricky unless you've got a really willing patient. Pop up Vinny here, he's superstar. He loves treatment, even if it is in his mouth. So if we're obviously treating from external, we're going to have a few other considerations. So let's start with the mouth closed, and obviously we've got our lip folds in front here, so we don't have that direct contact to the gingiva. So one of the things, two considerations. First of all is your dose. You're going to use that slightly higher dose because you've got to penetrate through the lips as well. So I think it's normally 3 to 6 joules per centimetre square for mouth. You're probably going to go on that higher end. We're going to want to treat obviously the gingiva. So when we're using our anatomy to help, obviously depending on the region of the mouth we're trying to treat, but our target is generally the gingiva, periodontal tissues, and if we're going obviously dental roots indirectly as best as we can. If possible, you're going to want to do this in contact. Obviously, if the patient doesn't like you anywhere in the mouth, you'll use off contact. But the reason we use contact is, again, if we're going through the lips, we're just going to get that compression element. We're going to be able to penetrate through a little bit more effectively. And then you're going to be, again, moving your probe up and down that area there. So that's if you are treating with the mouth closed, and one of the benefits of the mouth being closed is it's a lot less stressful for the patient, so you do tend to get improved compliance, and it's, you know, it's absolutely fine for any form of periodontal disease, dental pain, post-dental inflammation, doing it that way. It gets a little bit tricky if you're trying to reach other aspects of the mouth. So if you were trying to reach at the back of the throat, at the roof of the mouth, for maybe foreign objects, other trauma, then it's a little bit more challenging. We really want the mouth open when it comes to, you know, other areas being damaged. So general dental disease, mouth closed, less stressful, but you want to be in contact and slightly higher dose rate. If we can have our mouth open, we're not going to want to be touching. So we're going to use off contact. Depending on the patient, depends on, you know, if you're using a larger head or a smaller head. But generally, it's usually a smaller head depending on the power used. And again, you know, either if you're doing over the gingiva, we're off contact here, and we're just going up and down that area. Off contact is very useful if we're trying to reach other areas of the mouth. So again, like I say, if you've got other trauma, ulceration or something, you're trying to get to the roof or back of the tongue or back of the mouth, then off contact can be useful to be able to reach that. And it's great because you are treating directly to the gums. So, you know, whereas when we're going through the lips, the mouth here, the risk is that, you know, we're not getting as much of our light penetrate through, whereas when we've got the mouth open, we're getting direct to the tissues that need it. So again, benefits for each direction. You just go with what's less stressful, what's going to be better for that patient, what's going to be able to get you to the area of the mouth that you need to. Generally, if their mouth's open though, especially if you're trying to get to the back of the mouth, unless they're really willing, it's normally done under some form of sedation anaesthetic. Whereas your general dental can be done without that. Obviously, one of the big considerations, we are near the head of the animal, so eye safety is a big one here. Again, just being really cautious about patients and making sure that they are willing and happy if you are opening the mouth and they are fully conscious. So I hope that helps explain how to apply laser therapy to the mouth to be most successful. And we will see you in episode 12, where we're going to start exploring the spine. So we're going to start getting a bit more musculoskeletal and start exploring all the anatomy, muscles, tendons, ligaments, nerves. So stay tuned for that episode coming soon.